Hi everyone, I'm Elisa Maffioli and I'm assistant professor at the Health Management and Policy Department, and I'm here to tell you today a little bit more about what we do in global health at HMP. In fact, I'm a development economist working in Africa, in Southeast Asia, and Latin America. A lot of things happened in 2020, including the global pandemic of COVID-19, and I think that should have made us realize how more than ever now health is global, how we are all interconnected, our health system in general. Working in global health is exciting, but it's also a little bit challenging because every day you need to learn about new people, new culture, new health system, what government around the globe are doing. But this learning aspect is what really is exciting, how working in global health can make you grow in a diverse and interdisciplinary environment. Think a little bit about when you got interested in global public health, or when you got interested in public health in general, and where you want to be, what you want to pursue in the next year. Think about whether you are interested or want to learn a little bit more about global. And how I think about it is really thinking about global health as an attitude. This is a quote from the editor of The Lancet that really describe global health as a way of looking at the world. It's about the universal nature of human predicament. It's a statement about our commitment to health as a fundamental quality of liberty and equity. My journey working in global public health started exactly at the point where you are today, before my master program. And between my bachelor and my master, in fact, I had the opportunity to travel to India for about 3 months through an internship opportunity with my university. And when I landed there, it was a totally different culture from Italy, where I'm from. People were so friendly. It kind of opened up a new world that I didn't know about, and I was so curious to learn. And from there, I kind of then spent about 2 years living in Africa, working for the World Bank, and I kept traveling and learning about new aspects and new problems, think about new ways of solving problems around the globe. I work with policymakers with the Ebola epidemic, and now very excited to use my research to inform policy decision in Myanmar, for example. I'm definitely not the only one doing global, and there are a lot of faculty working in global health in our department, at the school level, at the university in general. Here is just a list of some countries people are working, and in the department there are other faculty doing global, for example, Professor David Hutton, Melissa Crary, Kylie Scott, Jersey, Holly. Everyone is really excited to welcome new students working or interested in doing global, and try to connect you with people around the world and find the right placement for you. In the department, we also have a program that is called Global Health in Health Management and Policy, that provides a certain number of students with a Global Health Management and Policy certificate. And in fact, the program prepares this group of students to work in global health on both the policy and the management side of it, either internationally or kind of abroad, or in some institution within the US. Everyone can apply, so if you're doing an HSA or an PH program, you can apply for the certificate. You will be chosen at admission to actually do the certificate, and you will be trained to apply your health management and policy skills in a range of international contexts. The requirements are not too many. You have to take 3 courses that cover low, middle, and upper income countries. So first is my course, HMP 624, that really cover policy challenges in developing economies. You will have to take HMP 625 that will explore the health management and policy aspects in higher income countries. And finally, you will have to take a more broad course related to healthcare organizational in international settings, HMP 677. The most exciting part of the certificate is really being able to be placed in a global health internship. That means do your internship opportunity outside the US. And in fact, if you're part of the certificate program, you will need to do the internship internationally. You don't have to be scared about it. You just have to be ready to travel, hopefully soon, because it will help you definitely finding a placement that you like and support you also financially. So the School of Public Health will offer scholarship awards to students that decide to do the internship abroad, and a lot of other support is available throughout the offices and the program around campus. Just to give you a sense, a lot of people did their internship in the past in the US, but our global students did a different internship outside the US in different locations, including the UK, Myanmar, Israel, Ethiopia, Kenya, and a lot of other countries, kind of in Europe, in Africa, and Asia. And they were placed working in research or policy settings. Some of them collaborated with governments. Some students work in more hospital settings. Some were placed at the WHO. They work in the insurance companies as well as in the non-profit sector. So we'll try to find you what's right for you. And finally, just another pick of what we do at across campus. There are a lot of opportunity of engagement for people interested in global health. First of all, within the schools, we have the Office of Global Public Health that will keep you updated on everything that is happening, will help you and train you to be more about global or organize events around global health aspects of your courses. There are also other departments within and outside the School of Public Health where faculty is working around the globe. There is a program in Michigan Medicine called Global Reach where people coordinate and establish partnership around the world. This is just the map that you see in the slides is just an example of it, of where there are kind of established collaboration around the world. There are several centers at the university as well, including the African Center, the Center for Latin American and Caribbean Studies. And finally, just this year, there is a new center that was started thanks to generous donation that aim to really tackle the problem of health equity globally. So if you're interested, you should definitely learn more about it. And we are here to welcome you in doing global health as well if you are interested. So welcome to HMP.